Good afternoon. Thanks so much for joining us. Hi, Kim. It's great to see everyone. Just so you know, we will be recording this session and sharing that out shortly to those who registered for attendance, and then that you can share that out with your teams as well. Big thanks to this team of three that we have here together. The way that this came together is last year, we had a similar conversation with Stacy DeStefano, Consulting for Human Services, around mergers and acquisitions, strategic partnerships, some of the stigma that can exist surrounding that topic and concept. But we wanted to continue the mini session around that topic, and who better than two organizations who have partnered strategically and the group in Consulting for Human Services that brought that together. There's a whole lot of movement in the space, which they will talk more about what is taking place and the value that that can bring, but really excited for this conversation. We have Dominic Miller, who's the head of growth and partnerships at Consulting for Human Services, he'll be moderating a conversation. We've got Charles Sweeter, Chief Executive Officer of Keystone Human Services, and Kim Sonnefelt, who's the Vice President of Keystone Human Services and the Chief Executive Officer at Mainstay Life Services. So grateful for your time and looking forward to the conversation. Appreciate it. Dom, why don't you take it away?
Thanks, Danny. I really appreciate it. And Kim and Chuck, thank you for being here as well. I know that we've had the opportunity to talk about, merger acquisition, strategic growth in several forums. And so, like Danny had mentioned, this is really a continuation of that conversation. And to begin, really from Chuck, your perspective, for those in the room that aren't familiar with the affiliation of Keystone and Mainstay, I'm just curious to hear how you would describe that as of today. And then I'll pass it to you, Kim, after that to get Mainstay's perspective.
Sure. Before I get started, I just want to thank Give and thank CFHS for having us here today. Keystone and Mainstay, our affiliation became official on November 1st of 2025, so we're about 6 months post-affiliation date. And Kim and I first started talking about the affiliation. I mean, there were definite discussions, since I guess Kim started back in 2019. There were always those kind of discussions along the line, but discussions really started in earnest probably in June of 24. We were actually at a CFHS event and started talking at that point, and led to the affiliation. So fast forward 6 months in, with knowing Mainstay and their wonderful team, we knew this was going to be an incredible partnership for us, and it's been that and more. From our perspective, I think the teams are kind of organically at this point really just learning so much from each other, from the operations standpoint, from a development standpoint, human resources, all of those things. And in Pennsylvania, we have performance-based contracting, and the results of which tier you're in are a multi-million-dollar decision on your rates that you get for the following year. So that application was just due on March 15th, and our teams worked side by side, and it's such a benefit having, a team that is culturally like you, that is right there and gets the same thing and asks the same questions, and just having that partnership has been fabulous. But the performance-based contracting application was a very recent thing that we were working together on, even though we're doing two separate, obviously still, and will be performance-based contracting applications. Just having that there has been wonderful, having your expertise.
That's great. I think that, with Kim, your perspective from Mainstay and the experience, we were talking earlier about culture, which I think we'll get into a little more. But I'm wondering, from your standpoint, what was the moment you realized that affiliation or partnership was the right path forward?
Yeah, I think as Chuck just indicated, have been at Mainstay now since 2018, and as in my role as the CEO, is mission, the organization's stability, making sure that people have the lives they want to live, and the employees. So that's what my role was. And again, Mainstay always has been a very solid organization, great reputation. Just great long-term employees that have been there. However, we were also, when I started, about $21 million. And in Pennsylvania, there's providers that are anywhere from $1 million to, $750 million. And so, again, as the CEO, part of your job is to look strategically and down the road. And so I did think that partnership was something that we were going to have to do. I did feel that there was a lot of room for us to grow organically, but to be open to partnerships was something that I would have to work, number one, with the board of directors, which we'll talk about that. That was really hard. And then the employees. So we're in Pittsburgh based. Keystone is Harrisburg based. Pennsylvania is a weird sort of state. At least they weren't in Philly. But anyway, so I can say again, 6 months down the road, and it sounds sort of corny. It's actually gone a lot better than even I anticipated, because they're the larger organization. I mean, Chuck didn't say they're like 250 million compared to now Mainstay is 35 million. But again, they're a much larger organization. So there's some thoughts people have, like the smaller organization's going to lose their identity, they're going to tell you what to do, and that's just has not been true. I mean, certainly there has been a lot of learning and sharing together, but that was part of that, just knowing it was a real cultural fit between the two organizations, which I'm sure we'll talk some more about.
Absolutely, and you mentioned this, Kim, but Mainstay having a strong reputation, being in a solid position. I think, I'll pose this to you, Chuck, but we all know that the sector that we operate in, that we serve in, is going through headwinds that haven't seen these rapid shifts in the past, whether it's Medicaid funding, the results of the budget reconciliation bill, a workforce shortage crisis, but that's really more of a stasis because I don't think it's going away. And so, considering those factors, how much of that influenced your decision to move forward together versus moving forward from a position of strength? I think I know the answer, but I would like to hear from you and Chuck.
Yeah, I mean, it was just, the reason that the many reasons that we partnered with Mainstay. I mean, they've been around for as long as Keystone has, probably longer. It was a combination of two companies, one that was around even prior to the foundation of Keystone 50 plus years ago. So longevity, their reputation as an incredible provider, the strength of their management team, financial strength, innovation was another one that was very important for us, because some of the services that Mainstay provides, they work with medically complex individuals, they do Prader-Willi care, they're very progressive on remote supports and those types of things. So we went into this, and Kim knows it, not like, hey, we're going to just take over and we're doing all these things that are right, and we're going to put in all of our system. Like, no, we've got a lot to learn. We want to improve. Like, let's look at what's out there. Let's look at our best practice, and let's implement that as a team, because. It's. I mean, even they have a financial subsidiary that they have created. So, the innovation at Mainstay, and then hopefully at Keystone, we're adding resources to that innovation, and allowing that to flourish, and allowing them to do other innovation as putting some resources in to help the things that they're already doing. So, yeah, it has been, and those are the reasons, along with the strong leadership team at Mainstay also, that the affiliation was a no-brainer for us.
I love that, and because you're talking about it from not a standpoint of even efficiency, you're talking about it from a standpoint of best practices. How do we increase what we do so well how can Keystone not only supplement but allow, you said, flourish these things that Mainstay has done over the years and built that reputation on, which is quite different, and it's a different kind of approach to strategic partnership than one of distress, right? And so again, something Kim and I were talking about earlier around stigma, and just with merger and acquisition in our sector, it could mean so many different things. And so I'm wondering, Kim, from your perspective, how would you kind of deal with that notion of stigma with regards to merger and acquisition with organizations in our sector?
Yeah, I think, we really need to educate and celebrate. If we were for-profit organizations, right, this would be front page on the news. But I can tell you, even like a month ago, somebody had just asked me, why would you do that? Mainstay has no debt. We own all our property. Again, we have had organic growth. And so when somebody says that, I just say, well, why wouldn't we do it? We found a partner who is like-minded, who culturally is in line with us, and they have helped us be able to scale some of the things. The reality is I have a fabulous team. So one of our team is here. Crystal is here, our executive director of programs, and they are fabulous. But there's only so many of us. And as smaller organizations, we wear different hats, many hats. So they have a training department. We have one trainer. So things like that, we're able to capitalize on their training. We're able to innovate more. We're able to get the best and the brightest together and just really dream. So those things, I think, really talking about the benefits, and more organizations like Mainstay saying, like, why wouldn't we do this? Again, it expands the mission. It's what's best for individuals. It's what's best for the employees, and we're stronger together. I liken it to a relationship that, we have chosen each other, and now we're discovering all these things. Again, I'm not naive. Just like any good relationship, there'll probably be some things that we're like, we didn't know that. But again, it's been really, really great, the collaboration and people using one another on both sides. So. And there has not been, again, I think that people really worry about, if you're the smaller organization, right? What does that mean to your identity? We are Mainstay. Like Chuck will say, it's not, Keystone, Mainstay. We have our own brands. We actually just said, well, we should probably quit sponsoring the same conferences. Maybe like do one together and do a bigger sponsorship or something like that. So we've had talked about things like that, but we still have a board of directors. Chuck is on the board of directors, but he's pretty quiet director, actually. He doesn't say too much at the meetings, and so that's not true. You say something. So, but I mean, it's really been, MA&A is very honestly, it's, I don't want to say person-centered, but it's very specific to the organizations and culturally and what you design. So I think it's just sort of changing the narrative on this discussion.
Yeah, and people will ask, well, when are you going to change the name Mainstay? When are they going to go to Keystone? And it's like, Mainstay is out in the Pittsburgh area. Keystone was not out in the Pittsburgh area. The name Mainstay has a lot of value in the Pittsburgh area. Why would we rebrand it? And the name Mainstay is, it's valued. They're a quality organization. Same with the board of directors. It's like, well, you could just, not have a subsidiary board there. And it's like they have 15 directors that are professionally, they're great board members. We've taken 2 of them onto our parent board. So yeah, that board adds a ton of value and experience. So that the normal things that you see in some affiliation or partnership models, that's not what we were looking for here. And it wouldn't be the same with every organization. If an organization came to us that was distressed or that was having a lot of quality issues, and maybe I didn't want to stand by that name that was out there, or that they weren't, that the affiliation wasn't 2 companies coming together at a time of great strength. It might look different in that view, but this is the best way to proceed with this one.
Yeah. No, I love the analogy of the relationship. I really think that is true on so many levels, even with the surprises, right? And I think that there's nuance to it that actually becomes a benefit in terms of your interdependence. You grow together, you're doing more of the best practices that you do well, and then you can innovate on top of that. But in terms of the identity, I think, Chuck, I really appreciate you mentioning that because it comes up. It's like, well, what about, is Mainstay going to be Keystone, or like, what is this? And I think the thing you said, Kim, that was impactful around education, MA&A doesn't always look the same. In terms of the organization, the culture, the mission, all things that you mentioned, I think those are unique to each organization that, if you're going to partner together, it's not going to be the same. But I want to stick with the board because I know that was a sticking point for conversation around challenges. And so I'll start with you, Kim, and kind of what was the board decision-making process look like, and really how did they show up as the gas pedal and or the brake?
Yeah, it was very long. So we had started having conversations and had, met with other agencies, smaller, larger, probably since I came on board, so in 2019. And then we all know what happened in 2020.
Right.
So everything slowed down. And then in probably it was 2023, started having the conversation again about, partnership and what that looks like. And it had been on our strategic plan. I don't even want to tell you how long it was on the strategic plan, like longer, way before I got there. So again, we engaged Stacy and her group to do some education. But even still, there were people on the board who were very hesitant. Again, when you don't have any debt, you are growing, the reason is why. And so a ton of education, and then one day I finally said, I'm going to give you a timeline of every time we talked about this. And when I put it was like 3 pages, and I gave it to the board. And we did have some champions on our board that helped. So people in the industry, and somebody who worked for a large managed care company who was saying, look, if and when managed care comes, they're not going to contract with a $50 million organization. Like, you're going to have to be bigger, and here's the why. So there was a ton of education that was done with our board. And then we did have a small M&A committee. I think about this now, when we started having these conversations, this was way before HB1. Or, we were still getting money. We still had ARPA funds coming in. And so again, this is, what the board's job is. So that was part of, me educating that this is what your role is for the mission and to sustain the organization. But I think about, I'm so glad that we were, having these conversations and we've done what we've done, because I think these next couple of years are going to be really challenging. And, I just had a conversation with a foundation in the Pittsburgh area who has supported Mainstay for over 35 years. And they said, we're sorry, but we just can't do this any longer. Everybody has needs, and we cannot do this. So I think it's going to be really challenging coming up. So again, I'm glad the board had the courage to do what they needed to do. We had those champions on the board. It did take, though, 18 months. It took a long time. So,
Well, and I think one of the things that's important going through the process is, that when we would talk about something, then we would put it into writing and say, well, here's what this is going to look like, and let's take a look, so that you don't get down the line and the board thinks, oh, well, maybe did they say that was going to be like this, or did they say, like, everybody knows, and this is something that we had worked out, and then the boards on both sides know this is what we're agreeing to, and it's written out there in black and white. That helped the process a lot.
Yeah, help clarify. And also to go back to a reference point, I think, your example, Kim, of a timeline. It's like sometimes you really have to put in front of somebody for them to realize either this is how long this conversation has gone on, or we need to make a decision.
yeah.
Right? So that's great. Well, I do want to shift to just a conversation around culture. I think, in terms of culture, strategic partnership, And integration, I feel like culture is something that no one gives you a playbook for, but they say it's the most important part. Just curious from, both of your perspectives, how did you approach culture from communication to, frontline staff, DSPs, all the way up to executive management? And kind of how did you have those touch points to ensure that we're moving forward and kind of keeping things maybe more stable for those that were a little more concerned, and just kind of dealing with it on the whole?
I think, again, being the smaller organization, that, the concern always comes from the smaller organization, thinking, are we going to have jobs? Are they going to tell us what to do? And so we engaged early. So we actually, before, the ink was even done and all the contracts were completed, we were out in front of this. We wanted to make sure we were transparent. We let everybody know. The good thing, though, is that we had done some training with Keystone for years on social role valorization and the Keystone Institute. So the two organizations had, worked together before, so that was helpful. And again, I think that how we both see people as active citizens in their community and, really just, all focused on inclusion and innovation. It just was pretty natural, and they're just actually pretty good people. So
Yeah, that's great. Well, I love that you pointed out it's the smaller organization that has the concern, and they have those questions of who's going to have a job after this. Like, that's kind of the immediate thing, right? But I think it's just important to point out you had that socialization with Keystone already through the training touch points, and I feel like all things considered, that was probably a helpful tool that you had kind of leading into that. But from your perspective, Chuck?
Yeah, culture is something that, if that's not right, it doesn't matter that they have a great leadership team and things are, they're financially strong and all these things. Like, none of the rest of it matters if you don't have the culture part right. We've shared the same values-based training, social role valorization, for many years, so we knew going in that Mainstay, if you walked into Mainstay services and you walked into Keystone services prior to the affiliation, things are going to look fairly similar to that. So the culture part was very important. Also, even paying direct support professionals, Mainstay's rates and our rates are some of the highest in the state. So even from that perspective of rewarding people who are working for us, philosophies were similar. But, it wasn't a board perspective. Well, the board perspective for me, from a Keystone perspective, was easier, I think, from going through the affiliation, because folks knew Mainstay and folks wanted to partner with Mainstay. From my team perspective, I had the conversations with them because they're like, oh yes, let's put in our system as soon as possible in this. And it's like, are you really happy with our system on that? And we're that system's coming up for renewal at the end. Like, do you want to put that back in? So it's one of those things of don't assume that we're just going to take all of our systems and put them in there, because this is the time for best practice, and best practice may not be what we're doing. So it might not be what Mainstay's doing. It might be something totally different between the two of us. So just opening up our team to that was important, and making sure that they knew that was coming.
No, absolutely. I think you hit it on the head with it. This is the opportunity to improve. I have a question in here around logistics, around EHRs, billing systems, just any platforms that are used between the organizations. And if one's coming up for renewal, could be the time to say, let's pivot and go to something different. Mm-hmm. Just quickly on that, though, how has that been for you? Just merging of all of the platforms and the technology, or has it remained separate to a degree?
I mean, it still remains separate to this point, as we're still kind of learning from the organizations, and as you have contracts that are naturally expiring coming up. That'll be the time where we're looking at a lot of our systems in that way. So, and from a Mainstay perspective also, there are things that, that we have that I know that, hey, we can do better than this. So yeah, it's going through that process, but We haven't had a common system change yet, but I'm sure that will be coming up here as that happens.
Sure.
Yeah, and I was just going to say, I think that the teams have looked at systems that they would meet everybody's needs, but again, we haven't. We're not there yet. So
It's coming, but
Yeah.
the conversation has absolutely been started. I think that on the bigger picture, if we wanted to zoom out from just looking at the IDD and behavioral health sector, from your experience, I mean, we've been through so much just pre and post pandemic, right? Looking forward with some of the headwinds that I mentioned earlier, kind of where does strategic partnership and growth fit into the future of our field? From each of your opinions, because I know I have mine, and I'm obviously biased as a consultant, wanting to make sure that people do think about this. But having been on this side of it now, where would you see merger and acquisition fall into our field in the future?
I think that it's something that we're going to see more of. Again, if anybody is in the Pittsburgh area, there's really two major hospital systems. There used to be a ton of little hospitals, and so now there's two. So again, whether you think that's good or bad, when we could do comprehensive supports for people. So I'd like to see us really be able to partner more with, our physical health providers and some of the other social determinants of health, people doing good work out there to really have comprehensive supports for people. So I think the more that we could, just circle around a person, I think we're going to see more of that. I think it's what we have to do to really start seeing, outcomes that people want for their lives.
Yeah, I think consolidation is definitely coming in our space, and I think that a key part of that is really having talented staff and leadership to go through that and guide you through not just the consolidation part, but also some of those headwinds that are coming, and that's why partnering with other great organizations and being able to tap into that leadership team and grow together is going to be the key in the future.
I've heard it said, I agree, and I've heard it said you're either on the menu or at the table, and whether or not, you have a option to decide you want to do this merger and acquisition in your organization, it's coming anyway. And I really think that, that's what we're seeing. The trending is moving in the direction of that this is coming to your state, whether that's through, a policy change or a managed care organization coming in. And we're encouraging, CEOs and provider organizations to really think through this ahead of time, getting ahead of the curve and doing it from a position of strength when you are strong, and not from financial distress, with mission alignment as the key. The keystone to that whole thing. And I think this affiliation between Mainstay and Keystone does demonstrate that. You made that decision to do this early, perhaps before some of the headwinds got a little more intense. And so I appreciate both of those sentiments there, but I would agree on the whole that it's coming, and I think it has a place to fit in our sector, whether or not we want it to. So in moving to some of our closing thoughts, and I'm wondering if there's a CEO or board chair in this room or watching via the live stream starting to have the conversation about whether partnership makes sense for their organization. What's the first step or advice on the first step you would give them?
I would say have that conversation, start educating your boards, start talking about it. And, it really is something that I think people think about in financial distress or retirement.
Yeah.
And so that's the only time people talk about it. And so I think, again, it is a conversation to have early. And you may not ever decide it may not be for you. However, at least you're having the conversation, you're open to it. And what is going to make sure that your mission continues way after the CEO or the board chair is gone.
Have any thoughts, Chuck?
Yeah, I do think I do think board education and also leadership team education is important in this process. That we're looking to partner with people, and that's going to change the way that we do things here. So I think both of them being on board with that is important. And then also, from just your organization's perspective, thinking about what are you looking for in a partner? What do you do well? What do you not do well? And is geographic consideration, is financial, is size, is services? Like what are the drivers of asking why you're doing this too? Because growth for growth's sake is just not a good strategy. So I think finding that, and then, like I said, finding a partner that you are comfortable with, that shares your culture, because if that's not right, stop, basically, because it's not going to happen, and you're going to run into problems either early in the process or later in the process if that's the case.
Absolutely. Okay, well, last question. What gives you the most optimism in the IDD sector moving forward? So I know we've talked a lot about headwinds and some of maybe the stickier negative things that we're facing that I think strategic partnership solves for. But given this post affiliation, and now we're moving forward together, what gives you the optimism and motivation?
I'm always optimistic. I am so excited about some of the innovation that's going on. And again, we, both Mainstay and Keystone, have been really driving innovation and seeing people living independently and having lives that they are, really just celebrating because of these innovations. So again, I'm excited about, where technology is going, and what AI can help us with, and I am excited about the future.
Yeah, and for me, I'd say, and it might sound corny, but just going out once a month at least, I go out and spend a day with our staff and with people we support, and just seeing the difference in people's lives and seeing how excited the staff are, and like Kim said, some of the differences in technology and other areas that we've made in people's lives, and that always is that's an inspiring day. That's my favorite day of the month.
Yeah, absolutely. I missed the site visits now being a consultant, so I would agree. Well, that was my last question for you both. So, Danny, I'm not sure if we have some time for questions from the audience, but I'm happy to open it up. But before I do, I just want to thank you both for joining me today to talk about this important topic.
Thank you.
And I would like to thank you as well. What an impressive group. This was spurred as well. We got the opportunity, Kim, you talked about the whole health approach and integrating other parties. We were in San Diego at the BHT conference at Keystone and Mainstay alongside Centerstone and Brightly, which is a behavioral health, plus they have a Firefly arm, but it's $1 billion of service line. And then obviously you heard some of the figures around Keystone and Mainstay. They are doing very impressive things, but the consolidation around whole health and IDD, behavioral, and other considerations within the system, and the work that Consulting for Human Services is doing to pull this together and to help parties align. I love watching the dynamic between the two of them and learning more about the partnership that has taken place, because there's a lot to consider, and consolidation is happening all around us. And so why don't we give them a round of applause, and then potentially, maybe we save the applause and we open up to a couple questions. Sure. And obviously those of you who are on live stream, you cannot ask questions, but you can email or contact them. Chuck's on the board of ANCOR, so you can find him. But yeah, let's go with a couple questions and then end with a round of applause after. Dom, you cut the questions off, and we'll go from there.
Certainly. Any questions from our audience here? Just knocked it out of the park.
Had you seen other mergers and acquisitions going on before? Did that help spur this? Did you see it going on in other parts of the state or other parts of the country that really helped you realize it was time to do this?
I think I've seen it. Prior to joining Mainstay, I was with a much larger organization, and I've seen them do it, and I've seen some, and not from that organization because they had some really great ones. So I've seen some partnerships or affiliation and or mergers go really poorly, very poorly, and exactly what people were afraid of happened. Unfortunately, those were organizations in financial distress, or the CEO left for some reason. There was no succession planning, no planning for the board. And so when that happens, it's just devastating, because there are, I mean, we all got into this for people, right? And so those are the folks that are hurt, and all the employees, the DSPs who are there every day, that, again, everything changes because of, people not being open to doing this proactively, or waiting until it's way too late. So.
Yeah, and we've seen in the health system, particularly in Pennsylvania, seen some health system mergers that, as soon as they got together, you knew that wasn't going to work out very well, and then you see a quiet disaffiliation going on behind the scenes. But yeah, I would say, especially going into other states versus starting up organically, if you are going to start operations in another state, it's always really good to partner with somebody in that realm, because starting organically and putting an office and doing all of those things in other areas that are unknown to you is really difficult. Ours was all in Pennsylvania, so that was much easier, but I've seen out-of-state working well.
Very good. Yeah, go ahead.
Yeah, thank you. So my question is for Chuck. You mentioned that innovation was one of the things that really attracted you to start the conversation with Mainstay. I'd be interested in knowing what programs or activities, what innovative programs or activities really caught your attention and caught the attention of your board to engage in those acquisition conversations.
Yeah, definitely. Remote supports was definitely one. It's an area that Mainstay was using quite differently than Keystone. We were using, both of our organizations use technology heavily, but we're kind of across the spectrum. We use it in different ways. So I think both organizations can pick up on that aspect of things, but using technology differently. In addition, some different innovation, but also different services, like the medically complex care part that Mainstay is doing. It's something that we weren't familiar with at Keystone, but it's something that I would love to bring, to the eastern part of the state and expand that significantly. And also Prader-Willi, and we have some additional clinical resources that we can add there also. But again, expanding those types of care and populations. In addition, I'm telling your story here, but in addition, Mainstay has a financial subsidiary that they've created, that does representative payee and trusts and benefits consulting for people. And just that idea itself is very innovative. So that's something that we at Keystone, are shifting some of our folks into, obviously the ones who are interested in it, but then looking to take that and expand it even further. So much innovation, and hopefully we can add resources to that.
Yeah, that's great. Well, I think I'll pass it back to Danny as we're wrapping up time.
Sincerely, thank you so much. Appreciate the time. No lunch is a coveted hour, but we're grateful to have you here with us. And would you mind joining me in a round of applause for these three? Well, that's a wrap. Appreciate those in attendance on the interwebs, and we'll get recordings out. But really, again, grateful for your time in this conversation. So thanks.